And is there any nice way to like tell someone, hey, maybe you should go see a psychiatrist prior to your surgery? Because I haven't figured out a good way to do it. Because
Hmm.
I also worry that even if they don't have surgery with me, but if I say something like that to a person, that they might get upset that I even mentioned that, and then
Hmm.
just go and like trash me online or whatever people like to do.
Yeah. No, I think it's kind of normalizing the whole process. I mean, for you, if you're doing, a facelift or you're doing something cosmetic on that face, taking a step back and thinking, well, what's really going to happen after this procedure is over, right? It's going to change the way that you look, hopefully in a positive way. It's going to change the way that you perceive yourself, hopefully in a positive way, but it's going to be a huge adjustment for you. And all of these huge adjustments are a lot easier if you're able to process it ahead of time and
Hmm.
prepare for it and to think about it and to have somebody who's a trained, skilled professional who can talk to you about what this is going to be like and what this is going to, be for you so that and just say, I recommend to a lot of people
Yeah.
that before they have such a procedure, that they should be in some kind of therapy, just so that they have a sounding board and somebody to process it and deal with it. And I will work, in collaboration with them. If there's, if they have any questions or if I have questions, it's great to have that. But it's something that I strongly, strongly recommend to almost
Right.
everybody who comes in here because it's a drastic change. And I'm sure you've seen in your practice where it is a drastic change. I would think that when
Yeah.
people have surgeries, especially when something that's brought them a lot of distress or anxiety for a long time, when they have the surgery done, even if it goes unbelievably well, it's going to change them in a positive way that could be a huge shock to their system if they don't have somebody who they could process it with.